Hello and welcome to In Touch with Durham County, the show designed to provide you with information about Durham County government, people, programs, and services. I'm Deborah Craig Ray, General Manager of Strategic Planning and Innovation. In this new year, we're still here with you virtually, socially distancing, and bringing you important information. Today, we're so pleased to have as our guest Dr. Alicia Smith, Communications and Public Relations Manager for Durham County Public Health. During the pandemic, her work has been critical in helping us understand the breadth and the scope of services available to help us manage coronavirus. I'm looking forward to our conversation. In our second segment, we'll be joined by Derek Bowen, Durham County Elections Director, to talk about this year's elections process, which has already been packed with a few surprises. Dr. Smith, let's begin our conversation. We're just delighted to have you with us today.
Awesome. Glad to be here, Deborah.
So just for the sake of our viewers, when did you join Durham County Public Health?
Sure. I came in August of 2019, so a few months before the pandemic hit.
Yes. And where were you prior to joining our organization?
So right before I came here, I had actually left communications. I finished grad school and got a job doing statistics somewhere, and I hated it. And so I came back to communications because I've been doing comms for about 10 years before that.
Yeah, well, certainly their loss was our gain. So let's reflect back a little bit before coronavirus. Life before late 2019 and early 2020. So when you first came in to Durham County, what were your main responsibilities as a communicator for public health?
The responsibilities were similar. The message was certainly different and less urgent. So still communicating about our programs and services, events and things that we had here, routine reports like the annual report. And of course, if there were some kind of, emergency or larger scale issue, then being on site for that as well, still handling media and things like that. But say everything was a little less urgent back then.
Certainly. Now tell us about your staff.
So I don't have necessarily a communications team. I work a little bit with everybody and with all the departments because all of the divisions, nutrition, dental division, things like that. So I work a little bit with everyone. We do have a communications liaisons group. So someone appointed from all the divisions helps with communications things in their department. But as far as communications staff, I am the communications official staff for the health department.
I completely understand.
Right.
So, beginning around, February 2020, or maybe even a bit earlier, when did public health begin to hear about the pandemic?
Right. So we started meetings officially in January of 2020. So a couple months before I think everyone feels like the world shut down. Informally in my personal life, we're hearing of this weird kind of virus that came from China. I was like, oh, that's overseas, nothing to worry about. But of course, public health had the knowledge that it was very much something to pay attention to. So our first meetings about it were in January of 2020 before it really, really hit the United States and Durham.
So I'm sure you all were, of course, working collaboratively with state public health. And then, of course, Governor Cooper issues a state of emergency, and then Durham County enacts our stay-at-home orders and masking orders, and we're off to the races. So what were some of the early communication strategies and tools that you brought to bear as we learned more about COVID-19?
Sure. Well, at first, we, as in the nation, was learning while public health was learning a little bit. So it was really important to work with state agencies and federal agencies because we were getting the knowledge that they had and really trying to disseminate that to people while making clear, this is a developing sort of crisis. So we stay tuned as we learn more. But sharing safety info, what we had was so critical early on. We didn't have the extent of the knowledge that we had now, but it was like, here's what we know. Right now, we know, stay away from people as much as possible. Right now, we stood up our COVID page on our website because at first it was, the state has this page, okay, you can go here and read information, but it came home. So it was necessary to set up our own resources, set up our hotline, set up our social media, but we began really utilizing our social media to disseminate information. So at first it was very much just like, hey guys, this is what we know. Go to this page, learn what you can. Stay tuned. We're sharing what the state has. We're sharing what we know. We don't know everything we want to know right now, but we're going to share what we do. And of course, the Emergency Operations Center opened in the health department, and that was collaborative with a whole bunch of agencies in the county. So we were in there 12 hours a day. It was open every day, putting out what information we had as soon as we had it, and really hoping people were staying tuned.
Yeah, and I'll just remind our viewers that, that was during the time, those early days, when the county quotes shut down. And so it was basically key employees that were in the Emergency Operations Center doing that work. And so that was very, very important.
For sure. It was, I remember the stay-at-home order came out, and a lot of officers were getting sent home, and I'd never been in an emergency operations center or EOC before. And it was like, so are we going home? What's the deal? And it was like, no, you'll be here. So we were very much in person. I mean, social distancing as much as we can, in the big conference room we repurposed as an EOC. And eventually we did move virtual, but for the first several weeks, we were in there all day, every day, Monday through Sunday, then coming back the next day.
Yeah, you learned what essential personnel meant.
Absolutely.
So over the course of time, who were some of your partners in sharing communications about COVID within the community? I know you were sharing it, in our organization, but who were some of the partners you worked with in the community?
I'm trying to think if there's anyone we did not work with in the community. Of course, like I said, in the EOC in person, we had different county agencies. So we had fire, we had police, we had paramedics and things like that. But as far as communicating, because there was no one in the community who did not need this information, we really worked with everyone. I mean, we had our Joint Information Center meetings. At first, we had those every day, 5 days a week, and that had staff from every county department, a communications person from every department. So we had some county personnel there, we had library, city, everyone, and they really helped put out information where they could. And additionally, we worked with people who were not county city employees. I mean, you went to the grocery store, you saw information. You went at the ABC store, had our flyers up about how to stay safe. Yeah, you go there now, you can still see vaccine information in the ABC store. So anywhere we could think, anyone we could talk to, we said, hey, can you help us get this information out? Because it wasn't something that I could have done or that we could have done alone.
Yeah, it was so critical. And so I'm thinking back to, I guess it was December when the vaccines arrived, and then we had those various stages of a rollout, people age 65 and older, and then we had children, not children at that point, we had teachers and other groups. What was it like communicating about those specific opportunities to get the vaccine?
Right. Vaccines came, and it's funny, the communications wave, because at the beginning of the pandemic, everyone wanted to know everything. And then before December, I think some people were tired of it. They were like, we get it, wear weight wash, stay home. I get it. COVID is happening. Then December hit, and everybody was as interested and as excited as day one, because vaccines were exciting. I mean, they were good news. We finally had a stage in the pandemic where we were turning a corner, it felt like. So when vaccines came out, like you said, the rollout, only certain groups were available at first, but everybody wanted to know. Everybody wanted to know, when is it my turn? Are vaccines safe? How can I get them? Where do these things come from? So we were communicating to everyone, and it became as urgent to work with everyone again. Not that we never stopped working with everyone, we never stopped communicating, but the urgency picked back up again. So as far as communications, it became, once again, all hands on deck. Here's what we know. When we were going through these phases that the state and the federal government lined up for who gets vaccinated when, it did become more important to communicate to certain audiences again. So when we needed to reach paramedics, we needed to reach elderly people,
Welcome back to More in Touch. We're pleased to be joined by Derek Bowens. It's great to have you with us today, my friend.
Yes, glad to be here. Thank you, Deborah, as always.
So, first of all, I'd like to share congratulations to your team for winning a national award for your app, which redirects voters to poll locations with shorter wait times. Can you tell us a little bit about that?
Sure. So we worked with our county GIS or city county GIS through the city, a complete, totally free implementation for the Board of Elections, to leverage some applications that we were using for vote to allow voters to find their polling place and um, uh, find their elected official. To use within that system a tool that would allow voters to find an early voting site close to them, along with approximate wait times entered by our precinct officials. And it was just a great success for the 2020 general election. We had a lot of voters redirected to some of our alternative sites where lines weren't as busy. And because it was so great, we decided to submit that up for a national award through the Election Assistance Commission, and we were selected for outstanding innovations for a small jurisdiction. Although I think we're much bigger.
Yeah.
But yeah, it was great tool for voters and a great award.
Excellent. Excellent. We love it. So, about this year's 2022 election schedule, we've already seen changes to the schedule for statewide races. And, it seems like they're continuing to change it. The only thing I think I know right now is that the general election is on November 8th. Is that about right?
Yes, that has not been touched as of yet, but due to redistricting litigation, the Supreme Court actually delayed the what was the March 8th primary to May 17th. So we are operating on that schedule right now. Of course, a ruling was just made in the case, but is expected to be appealed and make it eventually to the Supreme Court regarding those maps. So we're just at a waiting game to see what happens with the appeals process.
Okay, well, very good. So let's talk about what specific races are on the ballot as it relates to Durham County first. Then we'll come back to the statewide races. So, what Durham County specific races are on our ballot this year?
So of course we have Durham County Sheriff. We've got Durham County. I've got my list here in case I miss one. Durham County Clerk of the Superior Court. We've got Durham County Board of Education. We also several offices in the Board of Education, of course, in Durham County. During the primary election, that is the actual election for school board. There is no candidates move to the general elections, which is why we call in Durham our election a primary and election in federal even numbered years. We also have Durham County, or rather Carytown Council. We got a Raleigh race, but that's yes, a Raleigh race, the small portion of Raleigh. So those are all the local races. And then, of course, we've got several state races, NC House, NC Senate, Council of State candidates, and also some judicial seats.
Right. So I know before the courts sort of intercede, some people had already filed. So what happens? Do they have to refile or do you hold that paperwork?
We would hold that. The only thing that would void those filings would be if maps are adjusted and those folks are taken out of their assigned district or jurisdiction, then they would have to refile in the appropriate jurisdiction during the new filing period, which is expected to begin on February 24th.
Okay, so here we are still in the midst of a COVID pandemic. I guess this will be the third year voting during a pandemic. I mean, what steps are being taken to continue to ensure personal safety when voters come to the polls? And how do you vote safely, in a COVID? Because we want to make sure people understand that it's safe.
Absolutely. Well, thanks to you and your team for assisting us with the Stay Healthy and Vote campaign in 2020, where we produced a video that laid out exactly what we plan to do in terms of mitigation and easing concerns related to COVID. The things discussed in that video, we'll be doing the same things, such as masks will be available for every voter that comes to polling places. We will be socially distanced with distancing markers. There will be shield barriers between our workers and voters. We'll have a cleanliness coordinator dedicated to sites to wipe down high contact surface areas to mitigate germ spread. And we'll also be doing pre and post cleanings before the sites open and after they close. And because of those mitigations, even in 2020 in North Carolina, there was no reported COVID-19 clusters related to voting, and there haven't been any subsequent to that. So we'll just keep those same measures because we've found them to be quite successful, and we're looking forward to voters coming out, participating in person.
Outstanding. So I also recall that you worked to develop videos to train your election workers in 2020. Why was that important? Because I know normally you had done in-person training.
Yeah, so we had a huge workforce. Of course, COVID-19 was fairly new. The first time we really dealt with it in terms of preparing for it was ahead of that 2020 general election, and it was a tight time frame and a lot of guidance coming out for us to respond to. So we ultimately decided to move to an online platform where we would be able to train all of our workers. And we actually got the platform idea from Durham County Public Health. We decided to contract that company, learn a software to build LMS content, and we released that for the 2020 general election and trained 1,000 plus workers. We decided to keep that model because our poll workers love the flexibility of being able to do it when they want it to. So we are planning to go 95% online learning from here on out with our workers with limited in person, regardless of COVID-19. So it's been a great, while of course we would rather not have COVID-19, I think it definitely has opened up the door for a lot of innovation and a lot of ease administratively for us and also our workers.
That's wonderful. So I'm curious, did we have any major election law changes in the General Assembly this past session? I know there were quite a few bills introduced.
Yes, there's always lots of bills introduced, but nothing significant in terms of an immediate effect on the elections process. There were, of course, after 2020, some laws that were softened, I should say, due to COVID-19, such as laws related to absentee by mail. Several of those reverted back to what they were prior to the bills that were passed related to COVID-19. But as far as any substantive bills that have passed, not so much yet. We're still waiting to hear more on photo identification that's currently in the court system. And of course, there's always bills introduced. I typically focus when we see it pass a house or get some traction in one of the chambers. But as of late, that has not been the case.
Very good. So for someone new to our community, what are the basic requirements to vote in North Carolina?
So in North Carolina, you have to be 18 years of age. You have to have been a resident of the county that you want to register in for at least 30 days preceding the election. You must be a citizen of the United States. You must not have been convicted of a felony, and you have not completed your sentence, including probation and parole, unless that is due to outstanding fines. There's an exception related to that. And of course, if you're 17 years of age and you'll be 18 by the date of a general election, you can register to vote in a window there and also participate in primary even this year if you'll be 18 by the date of the general election. So those are the general requirements, and the registration deadline is always 25 days preceding the election. So those are the general requirements to register.
All right. And so where does one register to vote?
So you can go to our website at decovotes.com to get a copy of the voter registration form that can be filled out electronically online, and then you can print it, bring it into our office or mail it to us. If you're a DMV customer, you can also register fully online. So that's a great option that many voters are using. But all that can be found on our website at DecoVotes. And you can also call us and we'll be happy to assist you, mail you a form, whatever you need to get that registration process completed.
Well, thank you so much. We're about out of time. Are there any final thoughts you'd like to make sure to share as we conclude?
I'll just say, please give us a call. Our number is 919-560-0700. If you have any questions related to voting, we're here to help. And we look forward to seeing everybody out in the polls whenever we have an election.
Whenever. Well, thank you so much, Derek, and thank members of your staff because you all do a great job in conducting our safe and fair elections.
Thank you, Deborah. As always, it's a pleasure.
All right. Well, that wraps up our show today. Thank you so much for joining us. We'll see you next time on In Touch with Durham County. Cheers.